This program has been paid for by the sponsor and does not reflect the views of PCN.
Hello and welcome to another edition of County Connections, a show all about how county government touches everyday life. I'm John Buffone with the County Commissioners Association of Pennsylvania, and today's episode will focus on the three legislative priorities for Pennsylvania counties in 2025: 911 reauthorization and funding, county mental health funding, and mail-in vote reform. These priorities were voted on by county leaders from across the Commonwealth and represent the issues with the most potential for positive impact to counties in the coming year. We're going to start with the number one priority in 2025, 911 reauthorization and funding. And joining us now is Sullivan County Commissioner Brian Hoffman, who also sits on the CCAP Emergency Management and Veterans Affairs Committee. Commissioner, thank you so much for taking some time to talk to us. Once again, 911 in the spotlight, but I want to take it back to basics because a lot of people don't really understand the roles that counties play in the 911 system. Can you help us understand that a little bit better?
Sure, be glad to. So county governments are the backbone of the 911 system. In fact, it's a statutory responsibility. The minimum standard for county governments is that we either provide a call center or we participate in a regionalized call center. And so that's a specific role statutory for counties to play, and but we also have help funding that operation.
And so the surcharge for 911 is currently $195 per month. A lot of people may not know what that term surcharge is or what that means. Can you help us understand that a little bit better?
Yeah. So essentially, a phone provider has the responsibility to assess, collect, and distribute that fee. And that fee then is part of the money that is distributed to county governments through a formula that helps the county government fund the service.
So you can actually see on a phone bill that there's a surcharge for 911?
Absolutely.
And so that goes to what you just spoke about in the county's role in the 911 system. Now, counties are asking for an increase to that surcharge. Why do you feel that's essential?
It's essential because the personnel and technology cost associated with providing the service that all citizens have become used to, it increases. It's just a statistical fact. So that is why we are asking for a reauthorization of this fee at an increased amount above the $1.95 mark.
What are some of the things that have evolved in 911? You spoke about technology, and obviously that would mean there's going to be an increased amount of money needed to sustain that. What are some of the things as far as next-gen 911, which is a term that people may not be familiar with? What are some of the things that are involved with 911 that are evolving technologically?
Next-gen 911, for example, you're talking geographical addressing that's in a computer-aided dispatch system. It's automatic. Those are technology costs. Technology costs that others may not consider, but is a reality for any computer-based system, is cybersecurity. And like all of these are technical costs that have to be accounted for in improving the systems.
Now, 911, a life-saving service, for the most part. If things play out as they are now, what problems could counties run into?
Well, if it's not properly funded, number one, county governments need the additional funding we expected. In fact, since 1990, county governments have received funding from the state to provide a standard service Commonwealth-wide. So if we don't have the appropriate funding, then you start to run the risk of maybe we're not keeping up on the technological updates. Perhaps we're not able to properly staff, because there's also personnel costs associated with this. And those are all risks that if we don't receive the appropriate funding, that you would start to get stale. You'd start to fall behind, and then perhaps you could reach a point where the 911 service is not what citizens deserve.
And that's a doomsday scenario where if someone were to call 911 and there's no one in a dispatch center, or the phone just keeps ringing. On the flip side of that, however, if funding is brought up to an adequate amount, what are some of the things, you mentioned staffing, some of the things that you could do with that increased funding?
Well, number one, you need trained, skilled professionals that are taking these calls, and so you can continue the training the way it should be conducted. The recruitment and retention of people to do this work, it is not easy work. It takes a toll on people. Could be a lot of pressure on these folks. So having adequate funding, as I mentioned, then the benefit is we will continue to be competitive and be able to staff.
And I want to talk about the other side of this because there's a sunset involved in this entire process. Another one of those terms that people may not be familiar with. Could you explain what a sunset is in this scenario and why it's crucial for counties to have these conversations with the legislature now?
Certainly. So there is a statutorial sunset on the current fee at $1.95, and that is January 31st, 2026. And that's known. So what we're asking for and what we need is to start having legislative discussions and actions now on, number one, renewing aside from increasing. And this cannot wait too long because county governments, in reality, we begin setting up our budgets in October. We run on a calendar budget. We really can't wait until the last minutes of December to appropriately plan on what this funding is going to be.
What happens if something does sunset? What happens then if something is not addressed by the time that sunset date hits?
The service has to continue. So worst case scenario, if we don't have at least the current 195 renewed, aside from having an increase, county governments will have to continue to provide this service at the total expense, which would be very bad for most counties. I would say, I could almost say all counties. It would be a disruption in our normal funding.
So as we kind of conclude this conversation, can you give us some final thoughts on why this is such a high priority for counties? Because I'm sure you've talked to a lot of different commissioners throughout the Commonwealth on why this is sticking in the forefront and why this needs to continue to be the number one priority for counties.
Well, it's number one priority because so many citizens count on it. That's off the top. This system can't fail. So many different things tie into this. So that's why I suspect why our association members voted this as the number one priority.
Well, Commissioner, thank you so much for taking some time to talk to us. We learned a lot here, and we'll be back with more County Connections right after this.
Watch PCN's coverage of Pennsylvania politics and policy, history and culture, sports, and more with the PCN Select app. Stream live events and video on demand from your favorite device. Politics and policy programming is available for free. No subscription necessary. Go to PCNTV.com and subscribe to access live sports streams and the full video on demand library. Download the PCN Select app to start streaming today.
Welcome back to County Connections. We're talking all about county's 2025 priorities, and we're going to move the conversation now to county mental health funding. And to help facilitate that conversation is Dauphin County Commissioner George Hartwick, who's also the chair of the CCAP Human Services Committee. Commissioner, welcome back to County Connections. Always great to talk to you.
Great to see you, John. Always grateful to be here.
Excellent. So, Commissioner, not to date you here, but you've been in county government for over 20 years now. How have you seen the mental health system change throughout the years?
Well, I've seen the entire transition from, the state hospital and formal system into what was supposed to be an integration into a community-based system, getting rid of the institutions, the old institutions that were plaguing and not providing the level of mental health services that were supposed to be consistent with somebody's ability to live in recovery in a way that could allow them the highest and best opportunity to enjoy their life. Instead, the promise was to be able to deinstitutionalize and make this huge investment into a community-based system that would provide much quicker access to services, the ability to be proactive with providing the access to services with not an institutional feel. The problem was, while the promise was made, there was never the investment made by the state to build out a community-based system with that level of access and service provision. In that community hospital integration plan, while services were built out, that community-based system has never really been built. So what we've seen, unfortunately, instead of seeing people taken care of in a state hospital setting, in many cases, individuals' only front door now is an emergency room. And unfortunately, the largest provider of behavioral health services in our state and in our nation is our county jails. And quite frankly, that's a disgrace and not where we need to be. Mental health is not a crime, and the ability to serve people and provide mental health services shouldn't be considered such.
Can you help us understand a little bit more the dire circumstances that counties are facing right now with a lack of mental health funding?
One of the things that I believe is one of the things I take most pride in seeing county commissioners across this Commonwealth is we don't allow our constituents to fall into serious emergencies. We always figure out a way to build the system and to provide a triage so we don't see major catastrophe from occurring. The problem is the safety net and the system that we have and the resources we have to be able to maintain that system are stretched to their limit. Right now, the need that we've seen has grown exponentially post-pandemic. We've got an issue related to employees and staffing, and the amount of dollars that we have to be able to invest in our behavioral health services, even though we've seen consecutive increases from the governor's budget of $20 million each year, it has clearly not kept up. I mean, we as I talk to county after county, we are all being forced to take a look at either cutting services, reducing the level of services, not making the critical investments in the front end of our services to be able to adequately take care of those behavioral health needs and issues that exist in our county.
And you mentioned that briefly, but I want to talk about the increases that counties have seen over the past 2 years. And while I'm sure counties appreciate any kind of bump, has it been enough? You alluded to that it isn't, but can you dig a little deeper on that?
So when we're talking about workers, we're going from minimum wage to paying workers in a salary that's going to be commensurate for the level of work that they do. Frontline workers in the behavioral health system are real heroes. Those individuals have a deep commitment to the people that we serve, and unfortunately, they're usually paid because they've got the heart for the work, the least amount of money. The staffing levels are down related to services. And just to keep up with those basic increases to keep our primary services staff, those dollars are barely covering. So while those increases are greatly appreciated, the majority of them have been spread out through various providers within our system that just simply are maintaining the status quo and in a position to reducing those level of services. Where we have seen some level of growth is by counties working across county borders and figuring out ways to partner with state agencies as well as our behavioral health managed care companies to be able to invest in things like our drop-in center, which provides alternatives for individuals besides the jail, besides the emergency room. It's a 24-hour, 7-day-a-week facility that actually has intake for those individuals in crisis and behavioral health. But we have no money, absent the ability to have state dollars to sustain those programs. And while we're seeing a true drop in 302s and the ability for folks not to have to go directly into our prisons, without that kind of sustainability and effort and partnership from the state with real revenues, these intercept zeros that are now models for other counties to be able to follow will not continue their operations. So what could be done if those funding levels are brought up to an adequate level? It's not just sustaining, but you probably want to build out some things too. Is it programs, staffing, capacity, decreased wait times? What can be addressed if that level was brought up? So right now, these drop-in centers are critically important in the model practice related to triaging up front. But when we talk about building out those services, it's talking about access to behavioral health services, wraparound services, access to housing, the ability to see a psychiatrist, the actual adolescent services that exist right now that are lacking the capacity to be able to provide individual help and access to those services. The base funds that we have are stretched to the limit, and the ability to actually invest those dollars will allow us to build the system, quite frankly, and the starts of that system that was promised with the closure of the state hospital system.
On the other end, if funding stays flat or just gets a nominal increase, what could counties be looking at down the road?
We're talking about cuts to basic services, the inability to even serve at the level that we're currently serving, and obviously the progress that's been made start to revert immediately related to just maintaining the status quo and probably making some significant cuts to basic level services.
And I've heard you mention this a few times, so I want to dig a little deeper on this. Can a lack of funding have some negative ripple effects on things like emergency rooms and county jails. Can you talk a little bit about that?
So the kind of investment that we're talking about up front and the kind of investment in the behavioral health system is so important. And it's multifaceted. It takes private pay insurance. It takes rates from behavioral health managed care companies. And there is a behavioral health task force that has been assembled by the state to take a look at the best build out of the system. Absent that kind of investment, absent the additional money and partnership, we are going to see that level of progress and those kind of partnerships reverting back to those options only being our jails and our emergency rooms. The impact on that fiscally without a small upfront investment is going to be dramatic, and it's going to be spending good money, bad money after good money. So ultimately, without that investment, we are going to see log jams, huge impacts on other system costs, and poor outcomes for those individuals that we serve.
Mental health has been such a big topic, not just in Pennsylvania, but nationwide. And so for your final thoughts on this issue, could you talk to our viewers a little bit about how we've done a good job of trying to break down that stigma, but now the money needs to follow that a little bit?
We have an obligation in our society to be able to treat those who have serious mental illness and mental illness in a way that is commensurate with our expectations of healthcare system. We need true parity. We need the ability to ensure that folks have access to the adequate level and the appropriate levels of care. Unfortunately, on the behavioral health side, we've not seen true parity with insurance providers, with access to services, and I've seen it be viewed, even from the state side, as a way to reduce the exposure from the system side, but the community-based side has not gotten that level of investment. We need a true partner in the healthcare system, a true partner in state government, and I believe these things are going to be decided where the rubber meets the road, and county government is where these services are directly provided within our community. In the state of Pennsylvania, the behavioral health system and the responsibility of its operations are actually done at the county level. Without a true partnership, without the kind of investment to be able to build out a system that can be a model for the rest of the country, we are going to be chasing our tails and figuring out a way to fix the brokenness that is a result, which is going to create additional exponential spending as well as poor outcomes for those individuals we serve. I know we can and will do better. I know that we've got commitments from folks in the bipartisan mental health caucus in the House. We're looking for some leadership in the Senate to be able to match that kind of investment. And we believe in true partnership, being able to lay plans and to show significant results. They are achievable in a partnership with the counties, but we need resources to make that occur.
Commissioner, thank you so much for taking some time to talk to us. Always a pleasure to have this conversation with you. We'll be back with more County Connections right after this.
PCN is Pennsylvania Politics and Policy. PCN is Pennsylvania History and Culture. PCN is Pennsylvania Sports. PCN is everything Pennsylvania.
Welcome back to County Connections. The final priority we're going to address today is mail-in voting reform. And joining us now is York County Commissioner Julie Wheeler, who also sits on the CCAP Election Reform Committee. Commissioner Wheeler, welcome back to County Connections. How are you doing?
Great to be here today.
Well, I want to start the conversation on this. From your county standpoint, how did the 2024 election go, just from York County standpoint, and then what you've heard maybe from other commissioners?
Sure. I think that York County did a fantastic job navigating the presidential election. Obviously, a lot of stress on the system. We know high voter turnout, not just in York County, but all across the Commonwealth. So that puts a lot of pressure on a system that requires a lot of labor-intensive work. But all in all, I think the county did a great job.
Now, 2020 was unprecedented, and so there was a lot of stuff to learn between 2020 and 2024. What were some of the lessons learned from your standpoint that you took into 2024?
So one of the things that we pride ourselves on in York County is continuous process improvement. So after each election cycle, the team gets together, we talk about what worked, what didn't, what can we improve, because at the end of the day, we want the experience for the voter to be a positive one, to be seamless, efficient, and all of those things. So we've been doing that after each election. Certainly in the 2020 primary, you had COVID and mail-in ballots hitting at the same time. So a lot of lessons to be learned there. So we've just segued those into how we run our elections today.
Now, let's talk about the team effort it takes. So what are some of the things that you do in your county to ensure the safety and security in the elections?
Sure. As I mentioned earlier, we are really into continuous process improvement. So one of the things that we've done is we have an emergency preparedness plan, and we get a group of county agency stakeholders. So this is a plan that's developed by the Board of Elections, the Sheriff's Department, the District Attorney's Office, emergency management, a whole group of individuals focused on ensuring emergency preparedness. So for example, if we had a cyber attack, we have a plan to deal with that. If we have a polling location that runs out of power, right, we have a plan to deal with that. So it's really trying to think ahead and anticipate what might happen, because at the end of the day, we want the folks that are working at the polls to feel safe and secure. We want the voters who are coming in to feel safe and secure. Again, we want it to be a pleasant process for them. At the end of the day, I would be remiss if I didn't mention our poll workers. I don't care what county we reference in Pennsylvania, we could not run a successful election day election without our poll workers. And these are folks that are our friends, they're our family. We see them at their grocery store, we may see them in church, or where we go to activities outside in the community. They really are friends and neighbors, and if it wasn't for them, we would not be successful on Election Day. So I really have to give a big shout out to the poll workers and thank them for all that they do.
Can you talk about, because this is part of the priorities for counties in 2025, some of the ambiguities in the election code that counties would like to see cleared up that might be able to help the efficiency of elections?
Sure. I think one area where there is still a lot of ambiguity is around what folks are calling early voting. Even though we don't have early voting in the Commonwealth of Pennsylvania, there is a perception that we do, because folks can come in and request a ballot over the counter. We had a lot of residents, especially this election cycle in York County, we had over 6,000 voters come in and request a ballot over the counter. Some of them came in and thought, where's the machine? We have early voting here. And, trying to explain to folks that it's not early voting like they have in other states like Florida. It's just the opportunity for you to come in, request your ballot over the counter, and hand it in. So looking for some clarity around that part of the process for elections offices.
Now, counties are also supporting moving back the deadline for absentee and mail-in ballots to 15 days prior to an election. How could that help county election offices and maybe even help the voters?
Sure. I know for York County, that would be the number one thing we would like to see fixed. 1 week before the election is really not enough time logistically for a voter to put in the request, to have the county process it, put it in the mail, get it to the voter, have the voter mail it back. And what we see a lot of times is folks who do wait to the last day to come in and put the request in, they're the ones that are coming in person. And it does take a lot of time because it's a very manual task. The other thing that counties have to do as part of the election prep for Election Day is prepare poll books. So whether you're using e-poll books or printed poll books, it's an activity that can't occur until the deadline to request a mail-in ballot has passed, because the poll book reflects whether or not a voter requested a mail-in ballot and whether or not that ballot came back. So if counties had an additional week, it would allow them sufficient time to do the prep for Election Day, but it would also help ensure the voter who wants to vote in the manner by mail can do so and not have to worry about bringing their ballot back into the elections office.
You talked about the pre-process and the process during and even some of the process afterwards. Can you talk about the efforts from the election office and the volunteers and the poll workers and the whole effort that goes in? This is not just a roll out the machines on Election Day kind of thing.
Yeah, I think there's a perception out there that it's all about Election Day. Election work doesn't stop. It's really 365 days a year. There's a lot of work that goes into what we all see on Election Day. Voter registrations, cleaning up voter rolls, printing ballots, ensure the ballots meet the state guidelines. There is a ton of work that goes into preparing for an election. And then we have to save the documents. So ensuring that they get taken to archives, which is where we store them in York County. So a lot of work goes into an election.
It's a all year round kind of job.
It is all year round kind of job.
Now, another phrase that people hear a lot, but they may not understand, is pre-canvassing. Can you at least shed some light on what that means? There's a lot that goes into that, but can you shed some light on what pre-canvassing is?
So in its simplest terms, it's the activity that the elections office is able to do commencing at 7 a.m. on Election Day. In our state, we are not allowed to do pre-canvassing of any ballots till 7 a.m. on Election Day. So what happens at 7 a.m. on Election Day is election departments across the Commonwealth are able to start opening the mail-in ballots. So we're allowed to open them, we're allowed to take them out of the secrecy envelope, we're allowed to flatten them. We can even go as far as to run them through a scanner. But what we're not able to do is we can't tabulate or computate those results until the polls have closed. So it's all that pre-activity up into but not including computation tabulation that we're allowed to do. So for example, even the mail-in ballots that actually come in on Election Day, we have to wait to touch those until we're allowed to commence the canvassing activity. So pre-canvassing, 7 a.m. on Election Day, opening mail-in ballots and processing them up until before counting.
So how could extending that timeline help counties out a little bit to allow you to pre-canvass them a bit earlier?
Yeah. So much like the entire election process, it's very labor intensive. So when you think about, even if you have an electronic envelope opening machine, you still have 2 envelopes to open. So you have the mailing envelope, and then you have the secrecy envelope that needs to be opened. Then you must pull the ballot out. And in York County, those activities are done by different individuals. We never let the ballot and the ballot contents stay with one individual because we want to preserve the anonymity of the voter so that they can be assured that their vote is only known by them. So a lot of work goes into that. So from a prep standpoint, having some extra time to do that pre-canvassing work would provide a lot of help to the county elections offices.
There's so much that goes into elections, and we could probably turn this into a 3-hour show if we wanted to. But as we kind of wrap this up, what are some of your final thoughts on, once again, mail-in vote reform being a priority for counties, and what our viewers should know going forward whenever they get into an election cycle?
Yeah, I would like the viewers to know that not just in York County, but all 67 counties, elections offices are committed to running efficient, fair, and secure elections. It's something that we're all very, very passionate about. And whether Board of Elections are run by Republicans or Democrats, it is something that we agree across the board as county commissioners is really important, and we want to do the very best we can to ensure an efficient election.
Commissioner, thank you so much for taking some time to talk to us. We learned a lot during this segment. But that will do it for this edition of County Connections. I'd like to thank all of our guests for coming on. For more information about county priorities or county government in general, please visit www.pacounties.org.
This program has been paid for by the sponsor and does not reflect the views of PCN.